Okay, this is Dr. Bawarshi from Florida TMS Clinic in Tampa and Wesley Chapel. I specialize in treatment-resistant depression. I use medications, TMS, and esketamine for treatment of depression. All right, so today's question is, how many treatment sessions is TMS? TMS is Transcranial Magnetic Stimulation. The standard answer to this question is that TMS is total of 36 treatment sessions. So we do TMS 1 session a day, 5 days a week, Monday to Friday, for 6 weeks. After that, if a patient is responding to TMS, and we do taper-off treatment. Taper-off treatment is 3 sessions in week number 1, then 2 sessions in week number 2, then 1 session in week number 3. So those are 6 treatment sessions in 3 weeks. The reason for the taper-off is that it decreases the chances of a relapse or recurrent depressive episode. So it improves the durability of TMS, or transcranial magnetic stimulation. Okay, so that's the simple answer. The simple answer is total 36 treatment sessions. The acute phase, or the initial treatment, is 1 treatment a day, 5 days a week, Monday to Friday, for 6 weeks, and then after that taper off of 6 sessions over 3 weeks. All right, let's make things complicated, right? Let's look at the graph. First of all, I just wanted to show you where this number come from. Where did this number come from? It came from the pivotal trial that was published in 2007. Basically, the design of the treatment, or the protocol, was to do 5 days, maximum of 30 treatment sessions for 6 weeks, and then that's Monday to Friday, and then TMS was tapered in a blinded manner in 6 sessions across 3 weeks. Okay, now you notice here it doesn't specify exactly, but most of the patients who went through the taper off, it was 3 sessions, 2 sessions, and then 1 session, and that's why it was put in this way. Now, do some psychiatrists do it differently? Do some psychiatrists do 2 treatments, then 2 treatments, and 2 treatments, meaning that two sessions every week for the next 3 weeks? They do, but that's not really the standard one, okay? And by the way, if you are a psychiatrist who's taken insurance, and the insurance is the one who is paying for the patient treatment, you have to stick with the plan. And the plan is to be, 30 treatment sessions in 6 weeks, and then after that, 6 sessions taper off, 3, 2, 1. You can't just make up your own, taper off schedule, or try to do all of those in just 1 week or 2 weeks and just call it a day. Because the purpose of a taper off is basically a taper off, not just, to extend the treatment for 36 treatment sessions. Another thing, if you're a psychiatrist and doing this, or if your psychiatrist is doing this, is that if you do not respond to the treatment by 30th treatment session, you should not be doing taper off. Now, I do understand the school of thoughts who would say, let's extend more treatments because we could pick more patients if we continue doing TMS. Yes, sure, go for it. But you can't call this taper off. This is not taper off. This is just continuation of treatment. You extended the treatment further, and you're doing it on daily basis after that. So, be careful with this. We want to make sure that you're doing, that we're doing the right thing for our patient. And by the way, at Florida TMS Clinic, we often extend the treatment if somebody is a delayed responder. Let's say somebody started showing response to TMS by their 25th session or something. I'm not just gonna, go ahead and do the taper off right away after that. I extend for 10 more treatment sessions, for a total of 40 treatment sessions, and then after that I would do the taper off, 3 treatment sessions and 2 treatment sessions and 1 treatment session. Who's going to pay for the 10 sessions that were extra added? We eat the cost. That's on Florida TMS Clinic. So when we think that there is a medical necessity for something that insurance does not pay for it, we pay for it. That when I make a recommendation, and I pay for the price for it. I'm not going to charge the patient extra for those things. Okay, so let's look at other protocols, right? So you said, this is the standard, right? So what is not standard, right? So what is not standard is, for example, Brainsway, a pivotal trial that approved Deep TMS. Deep TMS, the brand name is trademarked. Though it's descriptive. When you say Deep TMS is descriptive, it's not really a brand, but anyways, they have the trademark for it. And by the way, I think a better descriptive of the H coil is diffuse TMS. So you can still keep the D for DTMS, but it's not for deep, it's for diffuse, because that's basically the main difference. Rather than it is deep, but the diffuse part is what's important for DTMS. All right. Anyways. So in that clinical trial, they actually did the treatment for 4 weeks consecutively, right? So you were doing daily treatment Monday to Friday for 4 weeks for 20 treatment sessions. Then after that, you did maintenance phase, which was 2 treatments per week for the next 12 weeks. All right? Okay. So when you see your psychiatrist and your psychiatrist is providing deep TMS and they tell you that we're going to do 30 treatment sessions and then 6 sessions taper off, and you tell them, well, where did that come from? And they'll tell, I don't know, that's what they told me. They told them wrong, right? Yes, I do understand there are other clinical trials that they did 6 weeks of treatments, and even beyond that, there are some clinical trials that went with 60 treatment sessions. But the pivotal trial that approved DTMS did 20 treatment sessions consecutively, and then after that, 2 treatments a week for the next 12 weeks. All right. Okay. So let's look at another variation, right? This is the Canadian variation of TMS. Okay. Let me show you this on the graph. It would be easier to kind of comprehend. Okay. All right. So technically, in a 3D trial, what they did is that they took about 400 patients. It's a little bit less than 400, and they split them into 2 arms of the clinical trial. One arm, they did theta burst stimulation, and theta burst stimulation is a higher energy, higher frequency triplet pulse done at the same location for the dorsolateral prefrontal cortex, but we don't need the patient to be on the treatment chair for 18 to 37 minutes like we do with RTMS. Rather, we just need 3 minutes and 9 seconds basically on the chair, just for 600 pulses of theta burst stimulation. So to kind of show the efficacy of ITPS, which is theta burst stimulation, they split patients into 2 arms. Each was about 200 patients, and they proceeded with the treatment for 4 weeks. So 20 treatment sessions. Now, some patients, they continued beyond 20 treatment sessions, but the end point of the trial was to see what happens with those patients at week number 4. So, regardless whether patients continued after that or not continued after that, they still followed up on them because they wanted to see that kind of the durability of the trial. But that was the end point of what they were looking for. And there is significant improvement in both arms of the trial, and that was the non-inferiority trial. And that's a Canadian trial, and in Canada they try to look at the cost effectiveness of TMS generally. So if I can help more patients by doing 20 treatment sessions than help less patients by doing 36 treatment sessions, I'd rather do 20 treatment sessions because they want to help as many as possible, with the amount of cost or the amount of money that they have available. So that's another pointer there, that maybe 4 weeks, should be fine. Okay, so the least that you can do TMS for is 20 treatment sessions. That's what I'm trying to tell you. And the standard is 30 treatment sessions plus 6 sessions of taper off after that. Okay, now obviously there are other deviations like SANT trial, which is Stanford Accelerated Intelligent Neuromodulation Therapy. Basically, 50 treatment sessions were delivered, but I'm going to make a dedicated video on accelerated TMS later. Okay. All right. So the bottom line is it's 30 treatment sessions plus 6 sessions of taper off. Thank you. Quick disclaimer before I leave you. Although I am a psychiatrist, this is not a professional advice, as I am not familiar with the uniqueness of your case. Please contact the psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. And if you have any questions that you would like me to answer, you can either submit them through our websites or leave them in the comments. I'm going to try to make some videos every couple of weeks answering questions that are related to treatment-resistant depression or TMS. Thank you.